1,500 patients and one doctor. This is the proportion we have in India. And get some aid like diagnosis for the diagnosis and immediate medical care, prediction. It will be easy for all doctors or health workers like ASHA workers, A&M workers and sisters to take the correct decisions. Here we don't have internet facilities in micro area in rural India. So some aid we should have that will help us. Sometimes the patient comes for the chest pain, but definitely they think that they have acidity and somebody suggests them go and take a rest. But it is usually heart attack and we lose the chances.
My name is Abhijit Joshi. I'm the student developer who built this. What Dr. Santosh just described, a frontline health worker standing next to a critical patient with no doctor available, no internet, and no clinical support. That's not the rare situation in the rural India. That's every day for nearly 1 million frontline health workers. So I built them a tool, multilingual, offline, and clinically grounded, powered by entirely Gemma 4, running locally on the device. No cloud, no internet, no patient data, leaving the machine ever. Hard score for cardiac cases, be fast for stroke, and trauma scoring. That's exact clinical framework doctor uses at bedside. Now in the hands of the person who needs them most. In Hindi, in English, in Marathi. Let me show you how it works.
Everything you are about to see runs entirely on this device. 3 real clinical scenarios, one in English, one in Hindi, one in Marathi. T by 95, heart rate 102, SpO2 94%, history of diabetes and hypertension. High urgency with confidence of 95%. Heart score 4 by 5 high risk. Time sensitivity within 90 minutes. एक महिला 8 महीने की गर्भवती है, उसका एक्सीडेंट हुआ है, पेट के नीचे बहुत दर्द हो रहा है और रक्तस्राव हो रहा है, क्या करना चाहिए? High urgency, confidence 90%. It is related to pregnancy and the accident at the same time. Acne. माझ्या चेहऱ्यावर खूप मुरूम आणि लालसर पिंपल्स आले आहेत, विशेषतः गालावर. काय उपचार करावा? It's low urgency, confidence 87%.
3 clinical decisions, 3 urgency levels, and 3 languages. 1 device with no network at all. This is what frontline health workers has access to for the first time. Multilingual, offline architecture, and clinical protocols. I did not decide these requirements sitting at a desk. Doctors and health workers in this environment told me what they needed. I built. Dr. Nikita has reviewed this system independently. This is her assessment.
A frontline worker like ASHA in rural India carries her training in her memory. No manuals in her hand, no access to internet, no specialists available on the call. And at that moment, when a 50-year-old patient is clutching his chest and she has to decide, hospital now or to wait, at that moment, the decision taken without support cost lives on everyday basis. I have evaluated the HealStation AI tool, the heart score for cardiac cases, the B-fast score for stroke cases. These are the real clinical protocols which are implemented very correctly, and these can be used on day-to-day basis to save lives of patients. The multilingual voice input in both Hindi and Marathi is a big source of convenience. This tool runs completely offline and there is no network requirement. This system does not replace as a doctor. Rather, it gives the person standing next to the patient the best possible chance of making the right call until a doctor arises. People will live because of this tool, those who have would not otherwise.